Hello, we're delighted to be here today to share with you the findings of this innovative research on putting patients first, physical and mental health interventions for post-COVID-19 pandemic recovery. I'm happy to introduce our team. This work is led by Dr. Karen Davison, who is the PI on this, and she's at Kwantlen Polytech University, as well as Dr. Simon Carroll at the University of Victoria. We are delighted to work with our patient partner, Marcy Dolce. Thank you so much for being here today, Marcy. And as you can see, there's an amazing team of scholars, Dr. Esme Fuller-Thompson from the University of Toronto, Brandon Hay from the Mental Health Commission of Canada, Professor Maura McPhee from the University of British Columbia, Dr. Ron Remick from the Mood Disorders Association of British Columbia, Linda Robson, who is also our patient advisor on this project, and Professor Victoria Smythe from Western University, as well as Lorna Stabler from Cardiff University. And my name is Vidhi Dakar. I worked in this project as a senior research associate with Kwantlen Polytech University. So this is our fantastic and amazing team. And I will hand it over to you now, Simon.
Hi, so this project is a project was funded by the Canadian Institutes of Health Research, as Vidhi said, and it was aimed at looking at interventions that were meant to mitigate COVID-19 related mental health risks for those with pre-existing chronic health conditions. And so we ended up doing a scoping review and what we call a rapid realist review. And today we'll be talking about mainly a framework derived from the rapid realist review. Their main reflections are looking at intersections among health and social inequities, physical health and mental health, and in particular, integrated health and social care are reflected in mental health promotion from individual to the policy level. Thanks, Vidhi. Next slide, please. So we took a realist approach to looking at this in order to look at the underlying mechanisms that we thought would support successful interventions to address mental health challenges of COVID-19. In particular, we're really looking at not just what seems to work in terms of outcomes to the extent that that was really available in the published literature and the gray literature at the time we did the review, but more how interventions might work or why they do or do not succeed for certain people in certain contexts. So that's the rationale for using what we call the realist approach, or the realist review approach. And in particular, it meant coming up with a broad program theory related to mental health promotion. In other words, what's the overall framework for understanding how mental health promotion might work in relation to the challenges of COVID-19. So after looking, sorry, can we stay at the last slide? Thank you. After looking at several consensus statements and other key publications, we developed a mental health promotion framework taking a socio-ecological approach. Thanks. Video, next slide. So as you can see, here's the framework that we developed. On the left-hand side, you see a nested socio-ecological model. And in the center, you have what we took the Keyes dual continuum model of mental health with looking at flourishing versus languishing mental health, and really looked at individuals and informal care support and the types of interventions relevant to that. Then on the next level, we looked at community assets for mental health, and then integrated health systems. And then finally, at the outer level, mental health promotion and mental health in all policies. At the bottom there, you see, including the concept of a mental health trajectory from early childhood to old age. And at the very bottom, you see the key settings where some of these interventions might take place to create supportive environments for mental health promotion interventions. On the right-hand side of the framework, you can see a series of potential threats at each of these levels that COVID-19 presented. So at the policy level, really, it was disrupting some of the gains that have been made over the last 20 years or so in refocusing on problems of mental health in Canadian society. At the next level, in terms of services, the problem of the disruption of psychosocial services for people suffering from mental health challenges and physical health challenges from COVID-19. And then key really as well were the more informal community health assets that could be disrupted by COVID-19. Of course, mainly through the types of restrictions, social isolation caused by COVID-19 restrictions. And then finally, same issues for the individual level, in particular, threats to ways in which people manage or cope with mental health challenges and the resilience mechanisms that they had. In terms of on the right-hand side, we organized the potential interventions, positive interventions along the lines of the Ottawa Charter for Health Promotion, except of course focused on mental health. So we have healthy public policy for mental health, reorienting mental health services, strengthening community mental health action, and developing personal mental health skills and resilience. Thanks, Vicki. Next slide, please. So the four nested levels of part of this ecological framework, you can see the micro level of self-care, immediate, informal cares, expanding out to the meso level, and then health and social care services and the macro policy context. In particular, we identified the key approach of intersectoral strategy aimed at promoting mental health and reducing inequity in mental health status. And building on the health in all policies approach, we call this mental health in all policies. Of course, this is really rooted far back in the Alma Ata Declaration and the Ottawa Charter for Health Promotion. From these foundations, health in all policies has developed over time as really the key WHO framework for implementing healthy public policy. So a key message for us is that this mental health in all policies approach is kind of the umbrella policy framework for thinking about the ecological model. And in particular, how is it meant to develop and implement policy that supports health and social service integration, which is really a key area for supporting mental health promotion. So it's this lack of integration that's one of the big barriers for successful mental health promotions. And then we use the 5 mechanisms we identified to take a whole government approach to encouraging the dismantling of these siloed services and the development of comprehensive, locally integrated health and social care services free of the point of use. So we kind of see COVID-19 as a bit of a burning platform. So we've known for a long time that integrated social care is really key. And of course, there's been lack of progress. But nevertheless, this is an opportunity to pay attention to the critical need for integrated care. And the idea of building back better means building back better without the siloed approach to health and social care that we have in Canada presently. Thanks, Vidi. So in terms of the actual realist review, we ended up with results that were derived at the different levels of the framework, the micro level, the meso level, the macro level. Thanks, Vidi. The 5 mechanisms that we looked at that we thought were key across the systems were trust, social connectedness, accountability, power, and resilience. During COVID-19, accountability has been absent at community individual levels, and focus on resilience has replaced power, empowerment, and power sharing. And so this is again, the framework just reminding people that the different levels are where we're looking at these different mechanisms. Go ahead, Marcy.
Thank you. Vidi, can we go to the framework model picture, please?
Sure, absolutely. There.
Thank you. Okay. Thank you for the opportunity to present my experience as a stroke patient, I no longer believe that there's anything such as a healthcare system, just individuals who can bravely blaze the trail and initiate change on a micro level. Thank you all for the work you do. I'm not a medical clinician and I can't speak for all patients, but I am grateful for the opportunity to speak my truth from my own experiences. Today, I would like to tell you my stroke story and share how this new model of integrating mental health promotion and social care could have radically improved my experiences. Okay, the beach blanket picture, Vidi, please. Marcy Dolce Nadezhnikaz, Robinson Superior Nadolce. My name is Marcy Dolce. I'm a Northern Ontario woman and a member of the Métis Nation of Ontario. I'm a 3-year stroke survivor. At 49, I experienced a major ischemic stroke to my left thalamus that ended my 25-year career in education and left me with cognitive, emotional, and physical impairments, as well as impacts to my mental health. My stroke occurred in the middle of the night. I woke up and couldn't move my entire right side. My speech was slurry and slow. Knowing the FAST acronym, I called for an ambulance. After arriving to emerge, the doctor refused to see me. Apparently, it was near the end of his shift and he didn't want to pick up a chart that would delay him. According to him, in his words, if it's a stroke, the damage is already done. I lay paralyzed, alone, and helpless for over an hour until code stroke was finally called and all hell broke loose. That was the beginning of my PTSD and the nightmares that give me insomnia. I spent a month in the hospital, and then in the middle of relearning how to walk and talk, my dad died. I needed to put my own needs aside to help my mom. After 10 weeks of grief-ridden generic outpatient rehab, I was discharged home with no follow-up or connections to appropriate further support in my community. The only resource I was directed to was a monthly stroke support group at the Senior Citizen Center, lumped in with people 20 years older to sing songs and have tea. I wanted more. I wanted my fantastic life back in full color with all my travels and adventures. I was at the peak of my career and I so badly wanted to go back to the job I loved. I was devastated I couldn't manage it. I spent many days having meltdowns and nights with insomnia and panic attacks and grief, trying to figure out what to do by Googling. My insurance company denied my disability on Christmas Eve. I spent the last 2 years stuck in a liminal space, subjected to long batteries of psychometric testing, filling out forms I didn't understand with a hand that can barely hold a pen, begging for more rehab, and fighting to be declared permanently disabled. It's a label I need, but don't want. It's a very dark place to be. This oppressive process is re-traumatizing and more than my damaged communication skills, cognitive abilities, and endurance can manage. A crushing blow to my identity as an intellectual and an academic, emotions I struggle to regulate. Navigating the long insurance claim is worse than the stroke itself. While I appeared okay, I wasn't. And then COVID. The pandemic compounded my depression and magnified my isolation. In addition, with struggling to recover from the stroke, I was also anxious about how COVID could affect my pregnant daughter, who is an ICU nurse, my newborn grandchild, and other vulnerable family and friends. Solutions to accessing support tend to hinge on technology and the assumption that everyone can use them. Learning new platforms and programs on my own, once something I excelled at before cognitive impairments, motor control, and communication disorders, it's very stressful and often creates more problems. These workarounds may benefit non-disabled people, but leave me exhausted, frustrated, and ashamed of my limitations. Patients don't experience health conditions in isolation, although health practitioners often specialize in treating individual health concerns. I'm so grateful for the expertise of clinicians in each of their fields, the sacrifices that they made to build their careers and continue to make every day. I didn't expect someone else to solve all my problems or know all the answers. I needed to be heard and validated and encouraged to pursue what works for me. I don't know how to ask that of clinicians who are already so overburdened, but I want them to know it would have meant the world to me when I needed it the most. This mental health for all framework posits having an entry point to initiate a health in all policies agenda. I'd like to affirm that every point has the potential to be an entry point. While I was missing ongoing professional support, where I did find support from was my best friend, my children, and my grandchildren, and my partner. Okay, Viddy, the wedding picture, please, who asked me to marry him in the middle of all this anyway. These people are my good medicine, and if it wasn't for them, I don't think I would have gotten out of that black hole. The medicine wheel picture, please, Viddy. As human beings, we are all multifaceted. The medicine wheel is an ancient indigenous model that shows how individuals are comprised of physical, emotional, mental, and spiritual aspects. In order to best treat the whole person, effective healthcare must include all these aspects as well. And all components of healthcare must integrate mental health. The medicine wheel can explain everything from a patient at the micro level to overhauling the entire medical system at the macro level. As a person with Métis heritage, the medicine wheel is important to me. It gives me a good way to think about my own treatment. With my resilience nearly exhausted, I decided to become my own rehab assistant and to treat my recovery with a Hail Mary, multifaceted, unconventional therapy activities. I aim to explore creative treatment possibilities in every sector of the medicine wheel. The trees picture, please, Viddy. Yeah. I discovered painting, which has become both a therapeutic exploration of my experiences, as well as an expression of my spiritual practice. The fish one. I caught my first fish. The next one, please. And I relearned how to bike. And the next one. And I revisited many other passions as ways to recover my abilities, which also improved my mental health. And the next picture, please, Viddy. My new granddaughter and I often shared developmental milestones. Next one, please. I also found a counselor who could help me deal with the effects of PTSD through art therapy, EMDR, and Otis, my emotional support dog. Approaching my therapy from a positive, patient-centered, and holistic point of view, rather than a deficit model, was a turning point for me. Now I was the expert in control. I'm convinced that creative, innovative, and flexible treatment approaches are essential to rebuilding resilience. In January, my mom was suddenly diagnosed with stage 4 ovarian cancer, and I was able to be her around-the-clock caregiver for 3 months until she died. The framework picture, please. This integrated mental health and social care delivery framework has significant, meaningful potential, especially for people with comorbidities. I may have discovered some of this for myself by accident, but the result has been a radically improved quality of life as a whole person, not just a patient. I believe our current situation is a snapshot of our future with aging demographics and the possibilities of other global health crises. We have an opportunity now to learn from our experiences and improve our strategies to integrate all aspects of care. Much of my own stroke journey has been marred by traumatic events and counterproductive obstacles that I've had to navigate on my own. I continue to spend a lot of my time, my limited energy and abilities fighting for what I deserve rather than focusing on my recovery. I've not received any other rehab other than what I provide for myself. Something is wrong with a system where this is the norm. I'm here to ask you to change it. A picture of my mom and dad, please. My parents participated in many clinical trials and medical research projects, and in their memory, I'm passionate about participating in research and encouraging innovative rehabilitation best practices so that other patients can have the recovery I wished I had experienced. The next picture, please. I appreciate the opportunity to share with you today. Thank you for helping me make the trauma that happened to me have meaning and hopefully benefit others. Thank you all for letting me tell my story as evidence that an integrated mental health care model would be beneficial and more inclusive for everyone at every level of healthcare. Chimigwich, thank you.
Thank you so much, Marcy, for sharing your story, and Simon for taking us through the framework. If you're interested in connecting with us and the research team, these are some of our publications that you can have a look at in terms of the Mental Health Commission of Canada resources and our framework, as well as the CIHR report. And please feel free to send an email to karen.davison@kpu.ca. We'd be happy to connect with you and collaborate with you as well.